everyone. Heather Holmes here with KTV Fox 2 News in the San Francisco Bay Area. And joining me this afternoon is Dr. Rashid Chitani. He is medical officer at IEM and someone that we've been talking to now for several months regarding COVID-19. And thank you so much, Doctor, for joining us once again.
Oh, it's my pleasure, Heather, and this is such an important subject for the country and the world, and it's still a crisis that is going on, so I'm happy to be talking about it.
Yeah, and one thing, Doctor, that is adding to the crisis is what we're seeing play out in Texas and other parts of the country that are just continuing to be battered by bad weather. And this has wider implications than just what we're seeing in the state of Texas in regards to people losing power and water and heat and those sort of things. I mean, this has big implications for our fight against COVID-19.
You're absolutely right. And I was in Texas and, felt the effects of the weather over there. Texas was obviously not prepared for any of this. And there were power outages for almost 3 days, and there was no water, there was no heat, and people were suffering. And, apart from that, one of the things that we have to think about is the logistics in terms of the movement of vaccine from point A to point B. Texas being a major hub in terms of transportation. Apart from Texas, there are a lot of other states that are being affected by the weather, and thus we've had tremendous vaccine delays getting to states, and from states getting to the jurisdictions. So vaccine shipment delays are forcing some serious issues in the South and the Midwest at this point.
Yeah, and also this is dramatically slowing the vaccination of people as well, because, for example, in Texas, the vaccination sites are closed due to the weather.
Absolutely. And, of course, that caused, we've talked about this before in terms of, if we had a perfect scenario, this is how many people we can vaccinate. So we'll never have a perfect scenario. There might be weather delays, there might be, shipment delays, but the weather delays are, having a vaccine center closed, not just that, you think about all the other things, hospitals losing power, the homeless who are COVID positive, where they're going to go, the people that need some treatment for vaccine for monoclonal antibodies. And Texas is, leading that effort in, across the United States in that particular element. And nothing could happen, right? Everything is closed. The roads are icy. So you can't get the patients in, and the individuals who want to get vaccinated, the 65 and above, the frontline healthcare workers, they cannot go get the vaccine, and it's become a problem and an issue not just in Texas, but a lot of other states because of the delay as well as access to getting to a place to get the vaccine.
And Doctor, one thing that we talked about was this idea of people who were waiting to get their second dose. I mean, what does this mean for them and whether the vaccine will be effective? If they had an appointment in Texas and now it's been delayed, I'm sure that there are people that might be worried about that.
So that's a very, very important question. And what I want people to understand is that they don't have to worry about it that much, okay? Yes, you're supposed to you're either supposed to wait 21 days or 26 days to get the vaccine, whether it's Moderna or Pfizer. But you can get the vaccine in the first 6 weeks after the first dose, and it is still going to be effective. So if you are on the list to get the second dose, and if you've been delayed because of the weather or because of supply chain issues, make sure that as soon as you can get there and get the vaccine. I was with the Department of Health and Texas Emergency Management folks yesterday, and yes, there was a delay in the shipment. Yes, there was a problem with the weather, but yesterday all the calls were going out to every single person who was supposed to get the second dose of vaccine. The vaccine has arrived over there, but yes, the vaccine centers were closed, but now they're going to start opening them again, and hopefully everybody that needed the second dose will get the second dose. But so when you get a call, make sure that you go there because it's still very effective. It is effective 6 weeks after the first dose, so you still have time.
Okay, and then Doctor, what are we taking away from this idea that the timeline to have a majority of Americans vaccinated just keeps getting pushed back further and further. The Biden administration now setting a more realistic goal, if you will, and saying that it is going to be several more months before that happens.
And we've talked about that. We clearly have discussed that. You know, the goals, initial goals, were extremely ambitious, and you know, there's so many factors associated with this whole thing. Talked about the weather, we talked about the supply chain. Then we have to talk about, you know, if the manufacturing is up to date, right? I mean, if they're manufacturing the stuff that they're saying, how many vaccines are going to be delivered? So that becomes an issue. Now, let me give you an example of what happened in California, which fortunately was not affected as much as other states. Right now, you know, 12% of the population of California has received the first dose, 3.8% has received the second dose, 8.4 million vaccines were delivered, and 6.2 million vaccines have been administered. That means 75% have been used. So those are the kind of numbers we are looking at. If the country maintains its current pace of administering the first dose, about half the population, I believe, would be at least partially vaccinated by around July, August timeframe. And then around late November, if the supply pledges are met and the vaccine eventually delivered, you know, by December or early January, we should be able to vaccinate most of the population. So what I'm hoping is that, you know, yes, there is going to be, we have to deal with weather, we have to deal with supply chain, if we have to deal with the pledges that the vaccine companies have made. But I'm hopeful that there are going to be 2 or 3 other vaccines that are going to come out. FDA will approve them, and at that point we'll have a larger number of vaccines out there, so we'll be able to populate. We'll be able to vaccinate our population. But one critical element still remains, okay, and that is, can we vaccinate eventually our children? And that is still out there. And I was listening to a town hall where a young child, I think second grader, asked President Biden, you know, I'm afraid, will I be able to get the vaccine? And you know, he did give a very realistic response in terms of that you are at the least risk at this point.
Mm-hmm.
And we've not really tested the vaccine among children. So, I mean, it's a conundrum at this point as to when are we going to be able to vaccinate our children and make sure that we also have the peace of mind and they are not scared, because children are scared right now. They've been at home in isolation, essentially, you know, and they feel that, oh my God, if I go outside, I might get that disease. And if I go to school, I'll get the disease, I'll bring it back home and I'll give it to my parents or my grandma or grandpa, and you know, you know, they might die of this thing. So there is a lot of psychological there are a lot of psychological issues associated with that. And you know, as a nation, we have to work together to deal with all of those questions and try to find ways for our children to have a healthier environment, so that they're not scared.
Yeah, I mean, so many fears, so much anxiety out there. Before I let you go, though, Doctor, we've been talking a lot about the numbers, and I think everyone sort of sees the numbers trending downward. But
Yes.
put that into perspective for us, if you
Yes, the numbers are definitely going down, which is very, very good news. But we are still at the peak levels that we saw in July of last year. Just think about that. Remember, in July of last year, we were all scared as to, you know, where are we going to go? These are such high numbers. We are still, our number of cases and number of deaths are still higher than what we saw on July 27th of 2020. So that is, you know, that's a scary part. And, you know, hospitalization rates are down, but they're still as high as we saw in July. So we are still not out of this thing. So there, you know, I mean, and you know, unfortunately, with the rate the numbers are going up, 2,000 deaths per day, we're going to lose by the end of, you know, by next week. By next week, we will be we would have lost 500,000 Americans, 500,000 Americans to this disease. That is a huge number. That means 500,000 families are not going to have one person, or maybe, I don't know how many people not part of their family. That is something that we have to think about. But we still are fighting. And, you know, as you know, that I've been all over the country fighting this disease from Virginia to Texas to Florida, where I am right now. And the fight continues. And we've got to continue working and trying to find solutions for this problem. But one thing is so important for everybody to understand, that we are still not out of the woods. We are happy that the numbers are going down. We are happy that we've got the vaccine. We are happy that we've got monoclonal antibodies, but we are still now not out of the woods as yet. And the two major factors that can help us are still masking and social distancing. Do not forget that we have a variant strain, multiple variant strain or mutant strains that are now in the United States. And if we do not observe these practices, the more variant and more deadly strain, according to some studies, anecdotal data that is available, the UK strain is the B117 strain, is going to take over the wild strain that we were seeing. The vaccine is effective against it, but then we have to deal with the South African strain. We have to deal with the Brazilian strain, and that's not going to be the end of it. We will have other mutant strains that will attack essentially our nation. So the sooner we get vaccinated, the better. Social distancing and masking we observe, the less cases there are going to be.
All right. Thank you so much for that important reminder. Dr. Rashid Chaitani of IEM, thank you again for joining us today.
Thank you so much for having me.